Hello, everyone, and welcome to the inaugural No Workplace Cancer Education webinar. I am Matt Kavorko from Cancer Council WA, where I'm responsible for coordinating Cancer Council's National Occupational and Environmental Cancer Prevention Project called No Workplace Cancer. And through this project, we aim to, one, reduce the incidence of cancer caused by exposure to carcinogens in the workplace and the broader environment. And then secondly, to communicate the importance of reducing exposure through known control measures. So one of our priority occupational carcinogens is diesel engine exhaust, which is the focus of today's webinar. Diesel engine exhaust, let's clear the air. Before we begin, in the spirit of deepening relationships, I would like to acknowledge all the traditional custodians and owners of country throughout Western Australia and Australia. And for the lands that I'm presenting from, that is the Whadjuk people from the Noongar Nation, and recognise their continuing connection to land, waters and community. And we also pay our respect to their elders and extend that respect to all Aboriginal peoples living and working in this area. So during this webinar, we encourage you to ask any questions you may have. So to submit your questions, please use the Q&A function located at the bottom of your screen. If the question is seeking clarification about a particular point that is being talked about, then we'll try to address it during the presentation. Otherwise, we'll have some time, about 15 or 20 minutes at the end of the presentation, to address them during the Q&A session. Finally, we would appreciate your feedback after the webinar. So an online evaluation survey will be sent out, and we encourage you to complete it so that we can improve our future webinars. So with that little housekeeping out of the way, it is my privilege to introduce you to today's guest speaker, Professor Tim Driscoll. Tim is an occupational epidemiologist and a specialist in occupational and environmental medicine and public health medicine. He is professor in the Sydney School of Public Health at the University of Sydney, and Tim's main areas of interest include the burden of occupational disease and injury, occupational cancer and exposure to occupational carcinogens, occupational lung disease, and then improving the communication of epidemiological principles and findings to the general public. So Tim is currently chair and a long-standing expert member of Cancer Council Australia's Occupational and Environmental Cancer Committee. And as such, I've had the wonderful privilege of working really closely with Tim over the last 4 years, where he has very generously shared his time and expertise, as well as sharing his love of kayaking and pelicans. So over to you, Tim.
Well, thanks very much to everyone for joining today. As Matt said, what we'd like to do is to present some information about diesel engine exhaust with a focus on the connection between diesel engine exhaust and cancer, but particularly looking at ways that you can decrease exposure, decrease your risk that might arise from any exposure. As Matt said, feel free to put any questions in the chat as we go along, and he'll keep an eye on them. And if we think we should deal with them during the presentation, I'll try to. Otherwise, we'll deal with them at the end. Matt's already mentioned acknowledgement to country. I'm at, well, the university's on Gadigal land. I'm actually on Camaragal land today because I'm presenting from home, but I'd also like to pay my respects. I don't think I've got any conflict of interest, but just to let you know that I have given advice to various government agencies about diesel engine exhaust and cancer in the past. This is what I'm planning to cover today, looking at what diesel engine exhaust is, how you get exposed, who's exposed, whether or not it causes cancer, a little bit about exposure and risk arising from exposure in general, and specifically with diesel engine exhaust, looking particularly how you might be able to prevent exposure or minimise exposure if you are going to have some exposure, and then we'll have some time for questions. But knowing that, well, here it's just after lunch. I'm on the East Coast, and depending on where you're listening to it, might be just after lunch or just before lunch. People can get a bit weary. So in case you want to nod off for a little while, I'm going to present to you the key points now that I'll come back to at the end, but here you'll know where we're going, and you can have a bit of a rest if you don't want to pay too much attention. So firstly, what is diesel engine exhaust? Well, it's a a mixture of things, a mixture of particles and gases and vapours. Who's exposed? Well, lots of people who work near where diesel engines are operating. Does it cause cancer? It definitely does. Definitely increases the risk of lung cancer. There's suspicion it increases the risk of bladder cancer as well, but the evidence for that's not quite as strong. In terms of exposure and risk, like most exposures, the higher exposure, the higher your risk, and that's a problem. But the good thing about that is the lower the exposure, the lower the risk. So if you can work to lower exposure, then you'll be working to lower your risk. In terms of how you prevent or control exposure, you need to use the hierarchy of control, which a lot of you will know about, I would expect. Some of you might not be so familiar with it, and I'll talk about that later on in the presentation. Okay, so that's where I'm going. Let's go back to the start. What is diesel engine exhaust? Well, diesel engine exhaust, like a car exhaust, it comes from the operation of a motor. And in this case, it comes from the operation of a diesel engine, a diesel motor. And diesel engines use diesel fuel. Basically, that's all you need to know. Combustion engine that uses diesel fuel. And it's used in lots of applications, both on-road and off-road. Some illustrations of those here. And actually, this has reminded me, I should say, I've pinched quite a few of these slides from Matt in a previous presentation. I've modified them a bit. And if there's any problems with them, they're mine rather than Matt's. But thank you, Matt, for letting me pinch some of your slides for the presentation today. In terms of what the exhaust is, so as I mentioned, it's a mixture of gases, vapours and particles, basically. Lots of different gaseous components, and I've listed some of them here. Lots of different particles. And I haven't listed the vapours, so I didn't think you needed to know that. In terms of who's exposed to diesel engine exhaust in Australia, well, Australia, like many countries, doesn't actually have good information on exposure. However, we're fortunate in that there was a really good study conducted quite a few years ago now, in the last decade, and I was involved in it, but I was only a very small player in it. The driver of it was Professor Lynn Fritchie at Curtin University, and it really was a well-designed and well-conducted study. It's the Australian Workplace Exposure Study. And it looked at a whole range of exposures, but in particular, it looked at carcinogens, so substances that cause cancer. And from that, we can get some good information on, or guidance as to the number and proportion of people who are exposed to diesel engine exhaust and the sort of occupations and industries that they work in. So I want to tell you just a little bit about the study so you can get a feel for what it looked at. So it was conducted 2011, 2012, so a bit over a decade ago. It was Australia-wide, had a random sample of both men and women aged between 18 and 65 who were working at that time. Had 5,000 people who were involved. It was a telephone interview, and information was collected on what people did and a little bit about them as well, but mainly on what they did. But the good thing about it was it wasn't asking people, well, what are you exposed to? Although that was a little part of it. It was mainly, what was your job and what did you do in that job? And using that information, the information was put into a program that Lynn and others had developed called OC Ideas, and the exposures were able to be determined based on the work that the people did and the tasks that they did. And in that study, they also collected information on the use of control measures, but I'm not going to present any of that information to you today. So the key thing is, it was national, it was a random sample, so it should be representative. Bearing in mind, there's always the issue about who responds and who doesn't, but basically we felt it was a representative sample. And it should have good information on the sort of exposures that they had. And there were a range of publications that came out of it. The information I'm going to present to you today came from this study, which looked at particularly at diesel engine exhaust. So based on the people who responded, there were 18 or 19% of them that were exposed to diesel engine exhaust in the job that they had at the time. And about 2/3 of those were deemed to be substantially exposed. That means it wasn't just trivial or passing exposure. About 1/5 of the males and about 5% of the females were exposed substantially in their work. In terms of across different jurisdictions, it ranged from about 6% in the ACT to 17% in Western Australia. There was variation in remoteness, so about 10% in the major cities. So 10% of workers in the major cities were exposed to diesel engine exhaust in their current job, about 28% of people in remote areas. And the reason for that is that's reflecting the jobs that they did. So people in remote areas were more likely to be doing jobs or tasks that in which they were exposed. In terms of the occupational groups with the highest proportion, don't look at the detail on that table. I'm going to highlight a few important bits. So in terms of agriculture, about 75% was substantially exposed, mining about 68%, transport 57%, mechanics, about half of the mechanics were deemed to be substantially exposed, and construction workers about 15%. So quite a range of different types of occupations and in different areas. But you can see that in quite a few of those, a significant proportion of the workers had more than trivial exposure to diesel engine exhaust. In terms of the entire working population, because what we were looking at there was the proportion of people who responded, and if you then modified the results to take into account the sampling, that was about 14% of the Australian workforce at the time, about 22% of males, about 5% of females nationally. And given that that was 2011, 2012, that was approximately 1.2 million people. So about 1 million males, about 200,000 females at the time. So a significant number of people, an important proportion of the workforce who are likely to be regularly exposed to diesel engine exhaust. Certainly they were at that time. There have been some changes to the workforce since then, but not major ones. So I think this is still pretty reflective of the current situation. Right, well, this is probably the most important thing. Does diesel engine exhaust cause cancer? Well, diesel engine exhaust, if you step away from cancer for a moment, diesel engine exhaust has quite a few effects. In terms of short term, it's mainly respiratory effects. It's an irritant, diesel engine exhaust. So if you're exposed at moderately high levels, it can definitely cause respiratory irritation. And as I mentioned here, headaches and nausea and dizziness as well. But it's mainly respiratory irritation. But long term, it can increase the risk of heart and lung disease. And in terms of that lung disease, so that could be chronic, non-cancerous lung disease, but also increases the risk of cancer. So there's no doubt that that's the case. And that's the focus of today's presentation, given that we're from Cancer Council. But what I'm going to say to you about prevention, of course, is relevant to the other health conditions as well. Now, I just want to take you a little bit more generally about cancer. I'll talk to you a little bit more generally about cancer. The International Agency for Research on Cancer, or IARC, which you might have heard referred to, is a World Health Organization body it's really the primary body in the world that looks at potentially cancer-causing exposures, looks at all the evidence and provides guidance as to whether that exposure does or probably does or might increase the risk of cancer in humans. And IARC in 2012 looked at all the evidence related to diesel engine exhaust and said, look, it's quite clear diesel engine exhaust does increase the risk of lung cancer. And they make a summary at the end of their big publication. So on the right, here's their big publication that they released after they looked at all the evidence. They're called monographs, and these monographs are 400, 500, 600 pages. But fortunately, they have a nice little summary at the end. And this is the key summary they made there, that there's sufficient evidence in humans for the carcinogenicity, that means causes cancer, of diesel engine exhaust diesel engine exhaust causes cancer of the lung. So that's clear. And as I mentioned before, there's a suspicion, there's certainly quite a bit of evidence to suggest it also increases the risk of cancer of the bladder, but it's not entirely clear about that, but definitely it causes cancer of the lung. And since we're talking about IARC, I wanted to mention just a little bit more broadly, because you might often hear in the news about, well, something's been said to possibly cause cancer or probably cause cancer or definitely cause cancer coming from IARC. And that's because when IARC looks at the evidence, at the end of that, it makes a determination as to whether it definitely causes cancer, which is called Group 1. Probably causes cancer, they call it Group 2A. Possibly causes cancer, they call Group 2B. And where there's not enough evidence, they call Group 3. And the evidence that is put together to make these determinations is epidemiological evidence, so human evidence, looking at studies of humans, and animal evidence, so looking at studies of laboratory animals, and what's called mechanistic evidence, looking at sort of lab-based studies and trying to work out the way that a substance is metabolized in biological systems to work out whether they're likely to cause cancer or not. Here are some other exposures that have been identified as Group 1, definite human carcinogen. You'll probably not be surprised about most of those. You might not know about alcohol, but alcohol definitely increases the risk of quite a number of different cancers. Okay, away from that, I want to talk to you a little bit about concepts of exposure and risk, not too much. Risk means that something might occur, but not that it will occur. So the risk is the probability, the likelihood, the chance that something would occur. So if you're exposed to a substance that increases the risk of an outcome, so in this case, let's say diesel engine exhaust increasing the risk of lung cancer, then really any exposure, even what might be seen as a trivial exposure, in theory increases the risk of lung cancer. But if it's just a very small amount, then the risk is really neither here nor there. It's a very, very tiny increased risk. Now, sometimes you need to get up to a certain level of exposure before there's any increased risk at all. But generally, with most things that cause cancer, that's not the case. We think of the fact that any exposure is likely to increase your risk. And the only way to have zero risk is to have zero exposure. And sometimes that's possible, but often that isn't. And it's important, given that, it's important to keep in mind that the higher the exposure, the higher the risk. So that's nearly always the case. The more exposure you have, and that usually means if you have longer term exposure, gives you more exposure, or if there's a higher concentration in the air, that gives you more exposure. So the higher the concentration and the longer period of time you're exposed, the higher your risk. And you might think, oh, well, that's bad, and it is bad. But on the other hand, it's good because it gives us a way of decreasing the risk, because the lower the exposure, the lower the risk. So if you can act, or your employer can act or the government can act to decrease your exposure, then that will definitely decrease your risk. In terms of, I sort of said this already, I guess, but just keeping in mind that the higher the exposure, the higher the risk, and that risk is going to be higher if you've got longer term or recurrent or higher level exposure. You should think about the sort of things that might affect that. So particularly if we're looking at the things that might affect or influence the level of exposure, it's where somebody might be working, the sort of ventilation that might be in place, the type of engine and the number of engines that are operating at a particular time, the way that they're used, and as I said, how long somebody's exposed. So all those factors and several others can influence what the level of exposure is or the length of time that somebody's exposed. And both those things are contributing to the total amount of exposure, and that's what's determining the, that's what's determining the risk. Okay, so given that, let's look at things that can be done to try and control that exposure, ideally avoid it altogether, and if not, to keep it as low as possible. Now, when you're thinking about controlling exposure, then what you should be going to is this hierarchy of control. And this is not just the case for diesel engine exhaust, of course. This is any exposure related to work, or even away for work, for that matter. And I hope most of you are familiar with this, but just in case some aren't, I want to go over it briefly. It's called a hierarchy because it has a number of different levels or options, and they're in an order. And you should start at the top and work your way down. So if what you do at the top gets rid of the exposure or controls it completely, fine, you don't need to do anything else. Otherwise, you work your way down and you keep adding as you need to or as you can. So we start at the top, we try and eliminate it. So, and I will go through particular examples of this with diesel engine exhaust, but an example of that would be don't use diesel engines at all, replace them with something else. Use an alternative, so it might be a different type of engine, for example, different fuel. You can isolate, you can separate the worker from the exposure. Use some sort of engineering controls, so that might be ventilation, for example. There's a whole range of administrative controls that could be used. And after you go through all of those, that's when you get to personal protective equipment, which might be, for example, goggles if you're protecting from some flying bit of metal, or might be a respirator if you're protecting from something that might be breathed in, like diesel engine exhaust. So it's just important to note that personal protective equipment, which in many circumstances might be very important, it's not the thing that you should go to first for a whole range of reasons, and I'll mention some of them later. But you should start at the top, work your way down, make sure all these other ones have been considered and where possible put in place. And if you still need to have better control or better protection, that's when you use the personal protective equipment. Okay, so now I'm going to go through each of those levels of the hierarchy, particularly with diesel engine exhaust in mind. So in terms of elimination, well, you would get rid of the diesel engines altogether and replace them with something else, particularly thinking of some sort of electric motor. And then you don't have the emissions at all, you don't need to worry. If you can't do that, and there are situations where you might not be able to, then you want to substitute the not so good diesel engines with the better diesel engines, and that's why we mentioned the new low emission engines. Or you might want to modify the fuel and make sure that you're using appropriate fuel and appropriate engines meeting the highest standards available. As we've mentioned, the US and Euro standards here. And the same with the fuel. In terms of isolation, so that's where you try and separate the person, the worker, the potentially exposed person from where the exposure is coming from. And so ideally, you wouldn't have a worker operating in the same area where a diesel engine is working. But often you can't avoid that completely because it might be a machinery that's being operated by a worker. Well, in that situation, you try and separate any of the other workers, get them away from where the diesel engine is operating if you can. And the person who is operating it, you want them separated from the exhaust as much as you can. And the best way to do that probably is to have them in a self-enclosed cabin where it's got its own air supply, not coming from where the diesel engine exhaust is, or, because often you've got to have it from that general vicinity, coming through an appropriate filter. In terms of engineering controls, well, the big thing here is ventilation. you need to have, I'll come back to that, the engine in a moment, but the big thing is the ventilation. So you need to have appropriate exhaust ventilation. We've mentioned dilution ventilation, which is useful, but particularly you want exhaust ventilation. Other things you can do is you can connect hoses, say, to the pipe. So instead of the exhaust going into the air in general, it's being exhausted out somewhere else where they're either to the outside, hopefully, and particularly where there aren't workers around. And I've also mentioned, in terms of engineering approaches, making sure that the engines are operating as efficiently as possible, that the maintenance is good on them. These are a couple of pictures just to show you how you might have direct removal of the exhaust rather than letting the engine's exhaust going out into, let's say, a big warehouse where diesel engine exhaust is operating. I've mentioned already about maintenance, so this, I guess, comes under the administrative controls a bit. Make sure that you've got an appropriate schedule to keep up to date with the maintenance with the engines. Test them, make sure that the exhaust systems are working well. Have appropriate administrative guidance and controls so that you're not leaving engines running when they don't need to run, for example. Switch them off whenever you can. Another thing that comes up under administrative controls, it's important that people who might be exposed are appropriately trained and understand both the issues involved in minimising exposure and also the importance of minimising exposure, but also how that can be done, and also so that they can recognise if control measures aren't working well, that can be recognised, and either they can let the appropriate people know to get it fixed up. Another thing that can often be done is to make sure that, I've mentioned a few times, minimising the number of workers who are around a particular process where there might be a diesel engine operating. So it's important to minimise the number of workers, but also minimise the amount of time that any one worker is in an area where they might be exposed. And then we get to personal protective equipment. So notice we've gone through all those other potential approaches to controlled exposure. And then, having dealt with all of those, if it's still felt that more protection is needed, and often that would be the case if people are working around a diesel engine, then that's when we're looking at personal protective equipment. In the case of diesel engine exhaust, and I don't think I said this explicitly early on, but the problem with exposure primarily is breathing it in. I mean, it can irritate the eyes as well, but the primary problem is breathing it in. So if we're going to have appropriate protection, personal protection, it needs to be respiratory protection. And it needs to be an appropriate respirator. I mean, ideally, it would be even a full face respirator with supplied air. So supplied clean air or supplied filtered air. That may not be appropriate in particular circumstances. So then you might have a half face respirator like the one here. But you've got to bear in mind that the respirator needs to be there. It needs to be fitted and the fit tested, and it needs to be still remain appropriate for a particular person. So, for example, it might be fit tested to someone who's clean shaven. If they then grow a beard and put the respirator on, it might no longer seal. In fact, it probably would no longer seal. So that's a thing that can get in the way of the usefulness of PPE. So they've got to be available, they've got to be fitted, fit tested, they've got to be maintained, you've got to make sure that the filters are still working. So there's a whole, and you've got to make sure that people know how to use them properly. So there's a whole range of things that might interfere with the way that respiratory protection, or whether respiratory protection will give the appropriate protection or not. It's not to say that respiratory protection shouldn't be used. There are some circumstances where it definitely should be used, just reinforcing the fact that you shouldn't just rely on it as the only thing to do. And I've gone through most of those points. Another thing to bear in mind that it's important to know whether the protective measures that are in place are working well. So the protective measures are there to decrease exposures to an acceptable level. And I guess it's an important thing to think about, well, what's an acceptable level? And guidance for that is given usually by workplace exposure standards. And workplace exposure standard is a level below which exposure should be kept in the workplace. It's not a cutoff between unsafe above and safe below. It's a level to which exposure should not go above, but you should try and get it as low as possible, not just be satisfied because it's below the workplace exposure standard. Always try and get exposure as low as can be done. Now, there's an issue with diesel engine exhaust, partly in terms of how to measure it, and the way that it's measured is through diesel particulate matter, or DPM. So basically looking at the amount of carbon in the air. And in Australia, there actually is not an exposure standard for diesel engine exhaust. There is one that's used, that people work towards, which is 0.1 milligrams per metre cubed. And that's sort of become a de facto standard in the country. And for example, that's the one that's used, as I understand, in mining in Western Australia and New South Wales and Queensland. But it's not a formal, there isn't a formal recommended standard nationally for diesel engine exhaust. And the problem with this one of 0.1 milligrams per metre cubed is it's way too high. It's not based on a health standard. It's not set to say, well, this is the level below which we should be to have appropriate protection from lung cancer, for example. And we, the Cancer Council, and others have been saying for a while that it definitely should be a lot lower. We feel it should be an order of magnitude lower and down at about 0.01 milligram per metre cubed rather than 0.1 milligram per metre cubed. But in a way, I was going to say it doesn't matter. It's not that it doesn't matter. It's important to have an appropriate standard, definitely. But regardless of what the standard is, should use the hierarchy of control to get the level as low as reasonably can. And given that, we should be able to get it well lower, down at below 0.01, definitely. That's what we should be looking at. And regardless of where the standard is, or if there isn't a standard, you should be using this hierarchy of control to get it down as low as possible. And if it can't be got down to a reasonable level, then you need to make sure people are using respiratory protection. Okay, almost finished. Just before I finish, I just want to mention the fact that if you're joining today, you're probably joining because you're interested in your health or your workers' health, and particularly interested in cancer. And given that, I think it's worthwhile thinking, I'm not trying to undermine what I've just said about what should be done with diesel engine exhaust. Diesel engine exhaust definitely increases the risk of lung cancer, and employers should have everything in control, everything in place in the workplace to have exposure to that as low as possible. But in addition, it's worthwhile thinking, if you're interested in decreasing your own risk of cancer in other areas, not just in the workplace, there are a number of things that can be done, practical things that you can look at doing. And I've listed them here. These are really the big six, that if you can look at these six, stop smoking if you do smoke. Hopefully you don't smoke, but if you do so, if you are smoking, stop smoking. If you really can't stop smoking, the less you smoke, the better. But stopping is clearly a better thing to do. Decrease the amount of alcohol you drink. It's not to say you shouldn't drink anything. You need to make that sort of judgment yourself. But there's no doubt that the less you drink, the lower the risk of cancer you would have from alcohol. Exercise regularly. No doubt regular exercise decreases the risk of a number of cancers. Eating as well as you can in terms of fruit and vegetables, maintaining an appropriate weight, making sure you're appropriately protected if you go outside. All of these things, if you can act on these, you'll definitely be decreasing your risk of cancer. But just to emphasize, I'm not trying to take away from the importance of what I've mentioned before, a diesel engine exhaust and a range of other potential exposures in the workplace that can increase your risk of cancer. It's very important that we have appropriate control measures in place to decrease exposures in the workplace. But in addition, if you're interested in trying to minimize your risk of cancer, these 6 things, if you can look at them, they'll definitely help. Okay, so back to the beginning now. What is diesel engine exhaust? I mentioned, I guess you don't really need to know for sure, but it's a complex mixture of things, gases and particles and vapors. There are a lot of people exposed to diesel engine exhaust or potentially exposed. Anyone who is working around where a diesel engine is operating, they'll be exposed. Diesel engine exhaust definitely causes lung cancer, might increase the risk of bladder cancer as well. That's not as clear, but definitely increases the risk of lung cancer. The higher your exposure, the higher your risk. But fortunately, the corollary of that is the lower the exposure, the lower the risk. And you can control, either prevent or minimize your level of exposure by using the hierarchy of control. And that's it. Hopefully that's been of some use to you, and I'd be very happy to answer any questions should you have them.
Thank you very much, Tim, for that presentation and a great overview of diesel engine exhaust and cancer risk and exposure and how to protect yourself and your fellow workers. Please use the Q&A function located at the bottom of your screen to submit any questions you may have. We do have one question to get the ball rolling. We have cases of ambulance vehicles leaking exhaust fumes into the cabin, causing the occupants to become unwell, cough, dizziness, disorientation, and in one case, a crew member was staggering on exiting the vehicle. So what is the likely detrimental health effects on a person long-term if it is only one exposure, albeit it's a quite serious exposure?
Okay, so I don't know for sure whether that's a diesel engine ambulance, but let's assume it was a diesel engine ambulance. So the question really there is, well, what if you have a single high level exposure? That sounds to me what the key issue is there. Actually, before I tackle that, let me say, if you've got a situation like that, I mean, that seems to me a very avoidable situation. So that is something that really needs to be looked at, because you don't want an exposure either for the member of the public or the worker in that situation. But as to the question of, does a single high-level exposure cause a problem? Look, in terms of lung cancer, the amount of exposure you would get in that sort of situation, so the total amount of exposure really isn't that high. So in that situation, I don't think somebody exposed in that situation should be concerned that they're going to develop lung cancer as a result of that single exposure. It's not to say you don't need to worry about that. It should be put aside and say, well, who cares? Because that's definitely not the case. And there are other issues, probably not long-term issues from a single exposure, but there's the respiratory irritation, the eye irritation, you mentioned the headache and disorientation, whether that was coming from the exhaust, it's a little bit unclear, but regardless, you don't want that sort of exposure, even if it wasn't going to meaningfully increase the risk of lung cancer in the long term. So in summary, I'd say a single exposure, not likely in my mind to what I would describe as meaningfully increase your risk of lung cancer, but recurrent exposures like that certainly could. And if it's happening once, you'd have to worry about what the control measures are in place, and definitely you would want to look at them.
Thanks.
That's a little bit waffly answer, I know, but basically the key messages are, you don't want that to occur. Something's got to be in place to stop it occurring again. But from a single exposure, I don't think you should worry in terms of cancer.
Yeah, good answer. And yeah, the participant confirmed that it's definitely a diesel engine in those ambulances. So
Right. So if it's,
yeah.
yeah, and there'll be other sources of exposure to it. If that's diesel engine, I would expect there'd be other situations where somebody might be exposed. So you want to try and avoid exposures as much as possible. So that sounds like a very preventable exposure circumstance to me.
And we have another question. So is the awareness of the risk associated with diesel engine exhaust widespread, both in terms of the general population and among those who work with these engine exhausts?
I'm not sure. I haven't seen good evidence to say that it is or it isn't, which I guess in itself is perhaps a bit of a problem. That I'm not aware that there's good information about that, but I don't know myself. Matt, what do you reckon?
My feeling is that it's relatively low, especially compared to some of the other carcinogens, such as asbestos. Yeah, it's not quite on that same level of awareness, that's for sure.
And I guess there's the danger because diesel engines are so common in the workplace that people just get used to them and not worry about them. So I think that there's plenty of scope for improvement, both in terms of awareness. I think I don't know that for sure, but I feel a bit like that on that. But there's definitely scope for improving how they're used and where they're used and whether they're used at all.
I have a couple more questions. So is it only aerosolized diesel particulates that are an issue? And is chronic exposure to the skin a problem?
Yeah. I haven't seen, I can't recall having seen information that would suggest that exposure to the skin is definitely a problem. But there's suspicion that the reason that diesel engine exhaust increases the risk of lung cancer is because of polycyclic aromatic hydrocarbons in the particulate exhaust that's sort of sitting on the carbon or absorbed to the carbon. And they increase the risk of lung cancer, but probably on the skin, I don't know that they definitely do, but there's a whole mixture of PAHs that can, and related compounds that are nasty in terms of causing cancer and that you wouldn't want sitting on your skin. So I don't think there's a definite answer to that, or at least if there is, I don't know what it is, but I would try and avoid having lots of dirt from a workplace where diesel engine exhausts are operating remaining on the skin. So it's not a case where I think the skin needs to be covered the whole time, but certainly where you'd want to keep the skin clean. So I'd be washing your hands after work, for example.
And given that, one of the questions is, should we be calling for a ban on diesel engines, at least in new vehicles?
Well, you always have to weigh up, in general, if you could avoid exposure, that's what you would want. But then you need to weigh up what would replace it and how easy is it to replace it, how much would it cost to replace it, would the replacement bring in any new hazardous exposures. Look, in general, if I could snap my fingers and get rid of all diesel and petrol engines and replace them with electric engines that were powered through renewable means rather than through coal, then I think that would be a good thing. But I think that's not a realistic thing at the moment. But any situation where a diesel engine can be replaced by an electric engine, for example, electric motor, I think that would be a good thing. But I don't think we're in a situation where we could say they should be banned, but I'd certainly like them to be phased out as soon as possible.
Absolutely. And we've got a few more. Let's see. So Nick says, fantastic presentation. Thank you.
Thank you. I was a bit worried, it's
so-
a bit stilted at times, but hopefully it didn't put you to sleep.
No, it was great. It was great. So if there are other exposures on the work site, such as respirable crystalline silica or silica dust, and fumes containing PAHs and VOCs, so volatile organic compounds, is it correct to assume that the risk increases even if there are no exceedances of that workplace exposure standard for all the substances, like individually?
In general, I think that's a reasonable thing to think about. The way that you look at it, if you go back to first principles and think, well, any exposure increases the risk. The lower the exposure, the lower the risk. Higher the exposure, the higher the risk. And each type of exposure will increase the risk. Now, it might depend on the pathways through which they operate, whether they operate through different biological pathways or not. But in general, each exposure to something that's known to increase the risk of cancer, let's say lung cancer in this situation, each exposure is going to increase the risk. So if you're exposed to, I'm going to making this up, but diesel engine exhaust, respirable crystalline silica, and asbestos, let's say, well, hopefully you would be exposed to asbestos. Let's just say those first two. Then if you were just exposed to one at a certain level, then I would think in general your risk was lower than if you're exposed to both at the same time. And if, let's say, you also smoked, your risk would be increasing as well. And all three together are likely to be adding to your risk. Now, it does depend whether that's a meaningful increase in risk, again, depends on the levels of exposure, because at very low levels, there will be some, in theory, increase in risk with most exposures, but I would normally look at it as trivial. And that's not to say it's we shouldn't be concerned about lowering the exposure as low as we can, but down at certain levels, like if I'm standing on a street corner and a diesel truck goes past, then I will have some exposure, but most of the time that's going to be relatively low. Well, it's going to be very low most of the time and very brief. And so I would describe that as a trivial exposure, and I wouldn't be worried about my increase in lung cancer in that situation. But if I'm on that corner 100 times a year and 100 trucks go past and I do that for 10 years, well, my exposure is probably not trivial. So getting back to that initial question, it's really multiple exposures or exposure to multiple things, each of which are thought to increase the risk. Yes, I think the total risk would be higher. And as the questioner rightly pointed out, that can be the case even if each individual one is below the exposure standard. And that's just to remember, the exposure standard, it's not a cutoff between unsafe above and safe below. It's really saying, here's a level that you shouldn't go above, but you should get as low as you can, regardless of what that is. And that's the case for diesel engine exhaust and for silica and anything else you might be exposed to in the workplace.
Yeah, absolutely. Absolutely. So we may not have, this is good, we've got lots of questions coming in. We may not be able to get to all of them, but if there's a few we don't address, we're more than happy to also respond offline and email participants directly responses to their questions. So we'll try answer a couple more. One of the ones is, should workers exposed to diesel engine exhaust be getting health monitoring? And is this something that employers are required to provide / pay for?
I'm not aware of any monitoring that would be useful in terms of personal monitoring. There should be monitoring of the levels of exposure in the workplace, so in the air, but I'm not aware of any biological monitoring or respiratory function tests or x-rays or anything like that that would be useful in terms of diesel engine exhaust. But But if there was, your question was, well, should employers pay for that? In general, I would say if there's monitoring that should be done as a result of exposures that are in the workplace, then I think, yes, it is the employer's responsibility to pay for that. Now, whether that's legally the case in all situations, I guess I can't speak for, but just as a general approach, I think that's true. I think that is the case and should be the case. But we should also bear in mind that there's a lot of people who would be exposed to diesel engine exhaust who are self-employed. So there's not always the employer who you would have to be responsible for it in that situation. Or another way to say is that the person might be their own employer, or they might have their own company that they work for.
So I reckon we'll go one more question. And this one is, I'm in the process of disputing the risk of diesel engine exhaust in my workplace. So regarding monitoring for trucks manufactured in the last decade, does the size of that particulate measured for matter? It's their understanding that uncaptured particulate from modern engines will likely be smaller, and the follow-up question to that is, what is an appropriate size range to monitor for, and what else should we consider for monitoring in an engine bay area?
Look, I don't think I know enough about the hygiene aspects of monitoring to answer that for sure. I'm not sure whether the person saying they're disputing that there is a risk or saying that there is a risk and someone else is saying there isn't, but let me just talk in general about that. Newer motors are thought to be safer, that the exhaust coming from newer motors is thought might have a lower risk of lung cancer than the older engines, which are seen as being dirtier, but I don't think that's known for sure. But definitely the lower the level of exhaust coming out, the better. But whether the nature of the exhaust coming from newer engines with newer fuels is lower risk than older engines with older fuels, I don't think it's known for sure. I think there's lots of reasons to think it might be, but I don't think it's known for sure. In terms of the approach to monitoring, you were talking about particle size. The best thing to do about that is to get a hygienist who really knows about it. If I tried to advise you, I might well be advising you wrongly. So in that situation, I'd be getting a competent hygienist and getting them to advise you on it.
No, exactly. And to follow up on that, to find a certified hygienist in Australia, you can go to the Australian Institute of Occupational Hygienists, and they've got a find a consultant search function, and yeah, hopefully someone can help.
And just thinking about the lead into that, yeah, Matt's going to mention about the Australian Institute of Occupational Hygienists in a moment, who have funded something that Cancer Council have done. So I should say that my answer about getting a hygienist was nothing to do with that. I'd forgotten about it when I said it. So I'm not trying to do that to drum up business for the hygienist. Just in general, that's a wise thing to do. If you need good advice on hygiene aspects, and diesel engine exhaust monitoring is one of those, then find yourself a good hygienist.
Before we conclude the webinar, I'd just like to take this opportunity to highlight that this week we are launching our diesel engine exhaust online awareness campaign. So the webinar forms part of that. And the aim of the campaign is to increase awareness of the health risks associated with diesel engine exhaust exposure in Australian workplaces, and then that need to use appropriate control measures to reduce exposure and then prevent future cases of lung cancer among workers in key industries. So the primary target audience for this campaign are workers in industries with like the highest prevalence of exposure to diesel engine exhaust, which Tim touched on in his presentation, including agriculture, mining, construction and transport workers, emergency workers as well, for instance. And a centerpiece of the campaign is an animated explainer video, and that's it will highlight what diesel engine exhaust is, how workers can be exposed, cancer risks associated with exposure, and then what control measures are available to protect workers and reduce their risk of diesel engine exhaust related cancer. So we'll be using both paid and organic social media posts across Instagram and Facebook targeting at-risk workers, and then on LinkedIn targeting industry and work health and safety professionals and decision makers. So you can scan the QR code on the screen, which will take you to our Diesel webpage, or you can go to Cancer Council Australia's website and search for Diesel, where you'll be able to view the animation when it's released later this week. You'll be able to watch a recording of this webinar, and you can also find out more information about diesel engine exhaust and cancer and download some free resources, including posters and a fact sheet. So people can support the campaign, namely through liking and sharing our content and posts across the various social media platforms, such as the Meta platform and LinkedIn. And we strongly encourage people and organizations to also share the animation and content via their own posts and channels and networks. And of course, I want to acknowledge that this campaign, and particularly the development of the animation, is being supported with funding from a grant from the Australian Institute of Occupational Hygienists Foundation, which we're incredibly grateful for. So thank you very much to the AIOH Foundation. And with that, I'd like to say thank you very much to Professor Tim Driscoll for your presentation, for answering all those questions, and also a big thank you for joining us today, everyone, online, and for helping generate some great discussion in that Q&A. If we didn't have a chance to respond, then we can try and take that up offline. And yeah, we hope you found it useful, and thank you very much.